Well, welcome everyone. For those of you in the room, I have this mic that you can't hear me from, but it is in fact for the folks online. So can everyone hear me at the back of the room? Ish, thumbs up, maybe. Okay. Well, great to see everyone and welcome to our Ignite event for the Children's Environmental Health Research Colloquium. My name is Megan MacDonald and I'm one of the co-investigators on this award and part of the development core. I have many colleagues in the room, but I am actually going to turn it over to one of our other investigators to introduce everyone. So today's event, we're going to hear from many of our pilot awardees, some past, some recently past, and then some current as well. So we're thrilled to hear what you've been up to, how things are going, and just really learning and connecting with each other today as well. We have our official timer at the front of the room. Marie Harvey is here. So we'll just really quickly, she will give you your 1 minute mark. We should be fine for time today as long as no one goes substantially over. I don't know if she brought her hook, but that might, oh, you did. Okay, good. I'll help with that as needed, and we'll share a little bit more on that in a second. But it's my pleasure to present my colleague, Megan McClelland. She's a professor, and the director of the Hallie Ford Center, the building that we're in right now, and she's going to share a little bit more about Aspire.
I have to be fast. Hi. I'm Megan. Well, there's lots of Megans. So that's Megan MacDonald and Marie Harvey that we already introduced. So I'm a professor, and I also direct the center, and I also co-direct Aspire with a great, phenomenal team, and including Molly Kyle, who just has to teach, and she'll be here a little bit late. So quickly, Aspire means Center for the Advancing Science, Practice, Programming, and Policy in Research Translation for Children's Environmental Health. We should say that 10 times fast. Basically, in a quick nutshell, NIEHS, it's an NIH-funded center, funded 6 of these centers across the U.S., Emory, Johns Hopkins, NYU, OSU, University of Penn, and USC in Southern California, and we were very lucky to get in with this group. What the point here is to really facilitate collaborations among experts across our center, to engage partners, to move this science into public health and clinical practice, translate the science on children's environmental health, develop new tools, methods, and intervention strategies, and then really to fund and stimulate pilot projects. So that's what we've done a lot of that. So we're going to talk about. We facilitate multi-directional interactions between stakeholders and that leads to the creation and dissemination of evidence-based environmental health programs that improves children's health and well-being. A thing that I love about this center is we really use these community-based partnerships. It's such a strength of this kind of a center to accelerate the adoption of evidence-informed interventions that really focus on reducing harmful environmental exposures in the places where children go to live, play, and go to school. So it's been a really fun group to work with. I feel very privileged. We have 3 different cores in the center. The admin core is led by Molly Kyle and Dixie Jackson, and I'm on that also, and we kind of make sure we have enough money. Sorry, that's way more than that. Dixie runs the whole show. And then we have the development core that's led by Meg MacDonald, Perry Heisted, and Andy Larkin, and they're here. And they do amazing work around data science, social media mining, super cool stuff, and catalyst pilot projects that really develop, sort of on the development side of developing and testing efficacy of evidence-based interventions. Translation core is the one that I lead with Veronica and Allison Myers and Nicole Bruner. We have a fantastic team that's really focused on translation of this research into practice. Veronica's done incredible work on scoping reviews. What do we know in the research that in terms of identifying best practices for community level change? And then we have funded a whole host of pilot intervention projects, or pilot projects, excuse me, especially focusing on really getting money out to community-based organizations. And then also understanding what the needs are, stakeholder needs assessments. We have a pilot project opportunity coming up. That is open November 1st, I think, and the deadline is December 30th. Am I right? Okay. I think so. I think that was somewhere on a list somewhere, but don't quote me. Dixie knows all, so maybe ask her. And am I ready to move on? How about that?
Yeah, thank you.
Woohoo! Okay, next. Sara.
Yeah, thank you. All right, thank you, Megan McClelland. So we are going to welcome Sara Jones from Ashland Forest Resiliency and Parichehr Salimifard from OSU's School of Civil and Construction Engineering. And I'm going to switch mics on you. There you go. So
Thank you.
Do you each, well, maybe, do you want to pass back and forth that way?
Sure.
Is that okay? Okay, perfect. Thanks.
Sarah, would you like to start?
Oh, sure. Hello, everyone. My name is Sara Jones, and I'm the Community Engagement Coordinator for the Ashland Forest Resiliency. And we're a forest collaborative that uses prescribed fire and produces smoke in Southern Oregon for Ashland, Oregon, to reduce our wildfire risk. And we have a project, Smokewise Ashland, that helps mobilize the community to be more ready for smoke.
Thank you, Sarah. Hello, everyone. My name is Parichehr Salimifard. I'm an assistant professor in the School of Civil and Construction Engineering, and I run the Sustainable, Healthy, and Resilient Buildings Lab. So today we're going to talk about our pilot projects that we had through the OSU Aspire Center and a little bit more updates about our more recent research. So Sara and I were two pilot project awardees on two separate projects through the OSU Aspire Center, and something that we are very grateful to the Aspire leadership was the fact that they were so great and wonderful in connecting the two different awardees together. Both we had different research questions and ideas, but both were on the topic of wildfire and indoor air quality improvement and improving the environmental health for children. So Sara has been working in this area in the field with boots on the ground so many years, and I was lucky to partner with her, and we did our research on the same school sites in Ashland, Oregon. You see pictures of some of our field visits where we were deploying sensors in schools there. And we were doing monitoring both indoor and outdoor air quality in these school sites. And through these pilot grants, we were able to continue our collaboration with Sara, as well as the OSU Aspire with Dr. Miley Kyle and Perry Heistad. And we applied for another EPA grant that luckily kind of opened up on a very close and relevant area and scope that we are focusing on. So the EPA grant is on wildfire smoke preparedness in community buildings. And the goals of our project, which is a 3-year project, we are in our year 1 currently, is to first focus on implementation and dissemination of best practices for both indoor air quality monitoring, as well as the interventions in terms of, for example, deploying air cleaners, or how do we improve our HVAC system and building envelope system. Another goal of this grant is to also develop a toolkit for schools in Oregon. Our first kind of focus is to focus on Ashland as our kind of living lab to help us develop this toolkit, and then hopefully be able to share this with the schools across Oregon. The initial pilot project study sites that we had in Ashland were a combination and a mix of different diverse types of school sites. We had schools, preschools. We also had public library, as well as science museum that does a lot of classes for children. So you can see those different sites here in Ashland map. But then as we were focused during our pilot project, we decided to really focus on and narrow down on 2 specific sites here because of the diversity that we had in these specific sites in various aspects. First, these 2 schools, the first one, Oregon Child Development Coalition site in Ashland, Briscoe School, is a much older building. So in terms of building, it has lower resource. Parts of this building doesn't even have HVA ventilation system, whereas Bellevue Elementary, another school, is in a wealthier neighborhood, and the school is newer and has HVAC system and so on. So both in terms of building systems and characteristics, as well as the population that these 2 school sites are serving, are very diverse. So we are hoping to focus more on these 2 sites as we are developing the toolkit. Also, we'd like to share some preliminary results from our data that we have been collecting in Briscoe School, the first school that I mentioned. So just a brief history of this school. Has been built many decades ago, but it had like 1 intervention and retrofit on the building a few decades ago. Sara can share the specific years on 1 wing of the building, and then more recently, about I think about maybe 10 years ago. Am I saying that year correctly, Sara? Or maybe 20?
Yeah, so the building at Oregon Child Development Coalition was built in 1949. It has one of the oldest boilers in the state of Oregon that's been certified. And it also, the central wing does not have any ventilation and cleaning for those classrooms, and it is the classrooms that have the most children utilizing those spaces. So.
Right. So the point here being that in the same school building, we have classrooms with ventilation system, we have classrooms without ventilation systems, and even those we have like different types in terms of like the envelope that has been retrofitted and so on. So here you can see the outdoor air quality data during 1 smoke event that we had in 2023 last year, and we have our outdoor air monitor in front of the building nearby a church, and you can see here how the PM 2.5 concentration is going very high. And we have also 2 different rooms, one class 4, which is one of the areas where it doesn't have a ventilation system, just has one of those window units. And then we have the staff room, which has received one of those newer ventilation systems. So in the same building, you can see how the outdoor exposure being so high. And the idea is that if you're indoors and you're sealing, you're supposed to get protection from the smoke fire. However, you can see that in one of the classrooms, still the exposure is very high, whereas in the staff room, as an example, we have better air quality. So this is just to give you one example of the kind of data that we're collecting and the kind of information that we're hoping to be able to add. There's some research questions that we have, as well as in the development of the toolkit. So with that, I'm going to pass it over to Sara to share some of the lessons learned that we had as well.
Thank you. So for our AQI monitoring, the data that's going into your project is really only as good as the deployment of those monitors. And we've had everything go wrong that you could possibly imagine with our air quality monitoring. So we've had this monitor here, the Purple Air 1, that kind of looks like a computer mouse. I believe that maybe somebody thought it was a computer mouse in one of our sites. So we're missing 2 of our monitors from Bellevue Elementary, for example. And so the monitors also go offline if they lose connection to the internet. So we've had password changes. And one of the ways that we're addressing that is with our quality assurance project plan that we have with the EPA. And so that is helping us take measures to be able to improve our data quality and data collection. And we have students coming down to Ashland to help us with that later in early November. So we've had students come 2 times, and they're coming a 3rd time, and they may come a 4th or 5th time as part of the new EPA grant that we have. And then maintaining the air purifiers, I've noticed that between the 2 sites that we have at Bellevue and Oregon Child Development Coalition is I've been able to do more training at Oregon Child Development Coalition. And so air quality interventions, the air cleaners are cleaner themselves and being maintained because of the training that I've been able to do there. And next slide. We held a summit in April, and this is helping us be able to coordinate at the state level for being able to develop out the toolkit, and we were able to get a lot of feedback from agencies and organizations serving children so that we can integrate their ideas into the toolkit. And these were some of the key takeaways from the Wildfire Smoke Preparedness Summit. And one of the key takeaways, it's not on here, but is that we do not have as much coordination as we need to, both at the local level and state level, to improve our public policy around how we can serve children better during wildfire smoke events and emergencies. So getting that pre-event preparedness in place, that can be having the monitoring equipment in there. So in the toolkit, we'll be developing how to install monitors in a way that school administrators, teachers would be able to understand and deploy themselves. And also, we're working to implement training. There's no training for schools in Oregon that improves, has them be more ready for smoke events. So we'll be working on a training program too. And one of the ways that we want to work on this too is to have effective communication strategies. So culturally responsive communication is an important way that we'll be integrating that into the toolkit. And here I want to thank all of the partners collaborating with us on the project. We have almost $700,000 EPA grant, and it would be great to hear from you and how you would like to collaborate on this project too. Thank you.
Thank you. I can take that from you, Sara.
Oh, thank you.
Thank you. Thank you very much, Sara and Parichehr. I should have also shared at the beginning that we are going to save questions until the end. So we'll have all of our presenters go, and then we'll have a brief break, and then we are actually going to have the opportunity to have a roundtable and questions for all of our presenters. So thank you so much. So again, Sara and Parichehr were awardees from year one, and we have another awardee from year one. So next up, we have Maria Paz Aguirre, community manager from Nurturely, who's going to present.
Thank you. Awesome. And I just passed the slides. Are they? Thank you. Can you hear me?
It's for online, so
Okay. I'm like, it's not. Hello. Awesome. Perfect. Hi, everybody. My name is Maria Paz Aguirre. I am the community manager at Nurturely. And I'm here to talk about our EnviroNatal equity progress and the next steps. So I'm just going to go really fast and talk about what Nurturely does. So we are a nonprofit that focus on equity in perinatal wellness. That means that all of our programs aim to tackle the root causes of inequities in pregnancy, postpartum, and infant health. And just for the sake of today's presentation, we have a big branch of our work that is what we call the EnviroNatal branch. And it really talks about how can we talk about perinatal equity if we are not talking about what's happening with our environment? And we tackle that kind of like intersection on climate justice and perinatal equity. So we do this through education, research, and community advocacy. So really to achieve health equity, we need to talk about what is happening. We usually see the same. The communities that are the most impacted are usually communities from the global majority, and we see that in perinatal health and climate effects, right? So how have we taken action? We have developed a climate education course that is called our Wildfires Toolkit. We have flyers, images, and multimedia that has been shared with various community partners. We have had advocacy at a state and local levels. We have been sharing our findings, our research, and our program evaluations to develop recommendations around our toolkits. You can scan this QR code and it's gonna take you to like the whole explanation. We didn't have too much time today, but if you wanna save that. So at a state level, we realize also when we talk about wildfires that pregnant people were left out of the vulnerable populations. When we're talking about wildfires and we're talking about like air filters distribution and when we're talking about extreme heat and talking about air conditioning and distributions, pregnant people were not part of the vulnerable population. So that's where we mainly focus our advocacy. And of course, that's where we focus our research, right? So our research around resiliency during environmental disasters, specifically here in Oregon around wildfires, a qualitative report that we did with Human Rights Watch on wildfires. And we're also working in diversifying the doula workforce in Oregon and providing those doulas with the training on climate disaster mitigation and resiliency. We have a big EnviroNatal Equity Week, and it's a call to action rooted in the urgency of supporting solutions at the intersection of perinatal health, racial inequity, and climate change. And during the days bridging Black Maternal Health Week and Earth Day, EnviroNatal Equity Week seeks to unite community experts and advocates for systemic and cultural change by hosting an awareness campaign and conference. So we also, with like a final, like a conclusion to our efforts, we have created our advocates program where you can get access to all of this training and toolkits in one platform. It includes many other trainings around racial equity and postpartum preparation lactation, but a big branch is this EnviroNatal branch. And it's a virtual learning platform when you get continuing education credits, but you can also learn about this intersection and you can have access to all of our toolkits. That's the computer. Okay, and I guess our questions are in the end, so thank you very much.
Thank you, Maria. Thank you. Thank you, Maria. And next up, we have one of our second year awardees, Daniel Chapman from the University of Oregon. There you go. Sorry.
Great. Need to get used to talking to a mic that's not on. Okay. So I am going to talk about parents' wildfire smoke-related perceptions and actions in the Pacific Northwest. So I am Dan. I don't go by Daniel. I am a researcher at the Center for Science Communication Research at the University of Oregon. I study environmental and risk communication. And this was a project that I got jointly funded in year one with Kathy Slavic, who, Kathy, I hope you can hear me because I think you're online. So she'll be tuning in and I'm sure she'll let me know if I missed anything. So I'm going to jump pretty quickly through three different research areas that we've been doing, sort of basic survey research with members of the public in the Pacific Northwest. I'm not going to go heavily into details, but if you have questions, feel free to let me know later. I'm going to try to cram a lot into a very short amount of time. So the first question that we were looking into is how air quality infographics influence protection motivation among parents. So protection motivation meaning their desires to keep their kids indoors during smoke events, limiting outdoor activities, altering school schedules, things like that. We actually talked about the results of this last year at Aspire, so I'm not going to go too heavily into the details, but we did now get this work published in a peer-reviewed journal, so I'm also happy to share that out with anybody. And we're working on publishing this next set as well, which is on how the use of and adherence to air quality indices varies in different areas of the Pacific Northwest. So we were particularly interested in looking at jurisdictional differences, meaning different states and different locales, and how they're communicating, and looking at how parents' self-reported use of and adherence to these messages varies across these jurisdictions. And this paper from this work is actually currently under review. And then finally, we've been doing some fun work where we took the survey data and we merged it with objective wildfire smoke data, so air quality index data. And we were looking at how the combination of objective and subjective, so your perception that you've been exposed, influences the actions you take to mitigate exposure. So the survey data that this project comes from, we recruited in 2023. We're actually planning some follow-up data collections now, which is exciting. This was parents or guardians of children aged 18 or younger in the Pacific Northwest. We had a roughly equal breakdown from the jurisdictions we were most interested in. More women than men participated, perhaps unsurprisingly. And we had about 50% with a bachelor's degree or higher. So this is just an example of one of the infographics that we provided on the screen to participants. So we gave them, this is an example of the Air Quality Health Index, which is used in Canada. So the Canadian participants and the American participants, we randomized which ones they saw. But we gave them a risk level and told them to imagine that they experienced this air quality level on a day where they had to make decisions about their children being outdoor or going to school. And then we gave them just some general recommendations about what to do during wildfire smoke. And so we found that certain formats, and in particular, we actually found the Air Quality Health Index scale, which uses a simpler 1 to 11 scale as opposed to 0 to 500, was actually more motivating for parents in this ambiguous moderate risk scenario. So when you see a moderate risk, there's actually still quite an elevated risk to children, and that gets overlooked in some of the messaging around this. So we were particularly curious if one of these infographics would actually help boost people's concern in that context. And we found that in this moderate context, a line and a gauge visual did better than just a table of information. So moving quickly into the next question, so looking at jurisdictional differences, we first asked whether air quality affected the decisions they made about their children participating in outdoor activities. I'll just show you one quick graph for each of these. So this is just the averages for each of the jurisdictions. And we see the thing that's most, you'll see a pattern with is we saw a lower rate for British Columbia relative to the US jurisdictions. This was true for this question, although I would note that it's still about 70% are saying that they did do this. So we still have a high rate overall. Next, when we ask about knowing where to check for air quality index information, and I should say for the Canadian participants, we varied and said health. We again see this disparity with British Columbia participants reporting lower amounts. And finally, when we asked about whether they follow the air quality index messages, we see the same pattern of results. So we're working on sorting this out. And finally, I know I have a limited amount of time, so I just want to show you what we've been doing on the third project. So this shows the average PM 2.5 on smoke days related to the actions that parents reported taking. So we see from the lowest to highest levels of PM 2.5, there's about a 1 action taken increase. Whereas for the subjective exposure, which is just asking people, were you exposed or not, we see about a 1.5 actions taken increase. So the subjective assessment, so people's own worry and concerns, perhaps unsurprisingly, is more motivating than just the actual objective conditions outside, which means that there's a good opportunity for messaging here to really increase people's concerns and actions. So in summary, I'm just going to pull all of these up quickly. Certain AQHI infographics outperform others in terms of motivating smoke-safe actions. We also saw jurisdiction level variation that we're still working out and sorting out, trying to understand what the differences are between BC and our other locales, although it was encouraging that Oregon tended to be the highest. And then finally, subjective smoke exposure is a strong predictor of smoke-safe actions, even more so than the objective exposure data. And so I just want to quickly thank the research team. Thank you for letting me talk very quickly. We have a couple of us at U of O, Kathy Slavic, Ellen Peters, Holly Smith, and Michael Coughlin. We have Perry here, who's been supporting on the objective smoke exposure data, as well as Stephanie McClelland at Simon Fraser. So thank you very much.
Thank you, Dan. All right, thank you. And next up, we have one of our own colleagues who you met earlier, Megan McClelland, is going to come present on behalf of Siew son Wong.
I'm not Siew son. I'm here to present on their project, which is on the Junior Outdoor Food Navigators. I did not time myself, so wow, it's going to be fast. So I'm presenting on behalf of Siew's son and Sharon Shen, who did this really very cool project. And it aims to foster youth climate resilience through a deep integration of food-themed climate change education and nature play. Which I just said. So I think it's important to acknowledge the multidisciplinary team that they have. They really utilize forestry, the Moore Family Center, the College of Health, College of Ag Sciences, Kid Spirit. This is really a cool collaboration. The focus here is to develop an effective model of creating meaningful and relevant climate change education experiences for youth that are really kind of done outdoors in fun and engaging nature play. So what they did, I have like 12 pages of notes, but what they basically did was they applied evidence-based strategies, and then they adapted curricula to create these customized play-based learning activities that could be done with youth outdoor. And it was a pretty broad range of age of children. You can see then what they did was they implemented these in summer camps through two OSU extension programs. They did a pre-post design, and you can see the age range here, 3rd to 5th grade, Kid Spirit. And then they also used OSU extension, 4-H youth development, so 6th to 12th grade. And then they looked at a host of outcomes, really interesting outcomes that focused on like cognitive learning about climate change and food systems, attitudinal and behavioral changes in environmental efficacy and pro-environment behavior, and then other health benefits, like did they feel more connected to nature and their psychological well-being. Oh, here we go. You can see the nice very cool pictures that I'm going to show you, but they're really creative in this curricula. So what they did was they implemented this according to two different formats. They have the long format here on the left, and then they tried a shorter format. So in the Kid Spirit implementation, there was a week-long, longer format to a younger group. Okay, those were the 3rd to 5th graders, and they're a smaller sample. Whereas in the shorter format, that was done with 4-H, and those were this is on the right, and they implemented the shorter version of a 75-minute workshop to middle and high school students. And this, so that's what these were here. The intervention activities included like these, this is a longer program of storytelling and lectures, play-based learning, outside, really cool stuff going on. And then they had a shorter version of some of that just included these mini lectures, play-based learning, and these food experiences. And then they did this pre-post set of assessments that I discussed quickly earlier, some drawing, they had some behavior observations, some focus groups. So it was a mixed method, qualitative and quantitative assessment pre-post. These are some of the cool pictures of the activities that they developed. You can see all outside in nature with some very fun climate-based activities. Including storytelling, the mini lectures, the puzzle solving, cooking, really cool stuff, actually. Okay, they have some findings and in general, you can see the long format goes to the top part, and then the short format results. And these are pretty preliminary, small sample size, especially with the long format. But you can see some indication that there was, this was not a randomized controlled trial, but what they did was a pre-post design where they found some change and some improvement in things, especially in the long format. Oh, I am doing good. We observed positive medium effects in knowledge, efficacy, nature connection, and well-being. This is, again, very preliminary, pretty small sample. In the short format down here on the bottom, you can see in the bolded, okay, these are the size of the effects. So some large effects and changes in pro-environmental behavior, medium to small effects in knowledge, nature connection, self-environmental efficacy, and a positive effect approaching a significance. Okay. Sorry. They are excited by this because they found these results even with a pretty short format. And I think they are still looking at the qualitative results, but basically I think what they are saying is that there is a huge amount of very positive feedback that students and children said it's the best summer camp ever. They want to keep learning about this. One child burst into tears at the end and said, I want this to keep going. And so their next steps really are to analyze some of their qualitative data, to publish their findings, and then they will continue to apply for funds to support a scale up of this program, to refine it, test it more effectively in a larger sample. And that's all. Am I done? Hooray!
Thank you.
No pressure. No pressure.
Thank you, Megan. Our final awardee from year 2 is coming to us by video. And I should introduce. So this is Anya Kamenetz, Climate Mental Health and Network Advisor, and it is, as you'll see from the title, Breaking the Silence, helping parents talk to kids about climate emotions.
My name is Anya Kamenetz from the Climate Mental Health Network, and this is our project, Breaking the Silence, helping parents talk to kids about climate emotions. With the help of OSU, we conducted translation research for the improvement of a guide to help parents talk with their children about climate change and manage the emotions that it brings. Climate emotions affect all of us, and particularly young people and people of color. We also find in research that parents feel guilt, moral injury, and vicarious trauma when thinking about the future that their children may be facing because of climate change. We conducted interviews with parents and caregivers of children under 18 in 17 states all across the country, and they resembled the United States in terms of their race and ethnicity. Mostly we spoke to mothers. We found that 100% of our families had experienced firsthand the signs of climate change in the place where they lived, and that ran the gamut from changes in the seasons, a lack of snow in the winter, to catastrophic hurricanes and wildfire smoke. Some people, in fact, had already relocated once from the impacts of climate change, only to experience it again in the new place where they lived. The Climate Emotions Wheel is a resource that Climate Mental Health Network created based on the work of Panu Bakala. And it demonstrates across 14 studies the most common emotions that people name in regards to climate change. In our interviews, we found anxiety predominated. We also found anger, frustration, and guilt. These were the emotions that parents reported for themselves in particular. For children, we also see a large amount of anxiety and frustration, but what is also a bit hopeful for children is that parents say that their children are interested in climate change. 13% reported interest. This word cloud represents a fuller range of emotions reported by the parents for themselves and for their children in regards to the climate crisis and the impacts that they're seeing where they live. We can see that there is a range of negative emotions, as well as some hope and some interest as well, and curiosity. These emotions were reported in many very young children. We found children as young as 2 or 3 who were upset because of snow not being there, or because they couldn't go outside and play because of wildfire smoke. And this was a report of a mom who said that she's having a lot of climate distress, which was a term that she gained from participating in our research. We also gathered resources, feedback on the resources we already have. And overall, we got very positive feedback. But we also know that parents want more. They want more multimedia programming, and they particularly said that they wanted more support from other parents. So we are hoping to continue and develop this research in a renewal grant, and we're applying for other sources of funding as well to further help the parents in our communities, the parents that we've reached with this work, to have the resources that they need to have emotional climate conversations and support their children in this very important work. Thank you so much.
Thank you. All right. So our next presenter is the next group that's coming through our current awardees in the pilot grant program, and we have Anya Ruiz Morillo, the founder and director of Training to Impact, who's going to present.
Thank you. Thanks. Hello, everyone. I'm putting my timer here really quick. Oh, I think are we good?
Might just be on the computer,
All right, so, okay, just, there it goes. All right, so, Mente Sana, Cuerpo Sano. Mi nombre es Ana Iris Ruiz Morillo. My name is Ana Iris Ruiz Morillo, and I am the founder and director at Training to Impact. We are an organization that work with the communities, with vulnerable communities, specifically the Latino community, to inspire change and empower the community, and mostly in the health field and the educational field. And we are very thankful for the support from MSU Aspire to allow us to collaborate with our partners, because we have tons of partners in the health field, including Latino Network, OHSU, and so many other partners, and the schools, to be able for us to do this pilot, Mente Sana, Cuerpo Sano. So in case you don't know Spanish, Mente Sana is a healthy mind, and Cuerpo Sano, you probably imagine, is a healthy body. So that's just a saying, very popular in the Spanish, Mente Sana, Cuerpo Sano, and that's why we chose that name. And what we did, we collaborated with a local artist to create Superhéroes del Planeta, which is bilingual. The pilot is a program to create a bilingual picture book, the first of a series for children 8. The book is 8 through 12 years old. It's proof and approved by children of that age. It's with children of color and different Latino cultures represented in the book, Afro-Latinos. So the language is very much diverse from the different Latino. There's language like from Mexico, Dominican Republic, Peru, so that the children can see themselves represented. And the idea is that we are using evidence-based data to create this book. So a lot of the work we have done at Training to Impact is developing curriculum for nonprofit organizations through Oregon Health Authority, so that we can promote climate action with the Latino community. So a lot of that research we used to create this book. You're gonna see the kiddos there in a little bit. The idea is to create, to raise awareness, but also reduce the exposure and the impact from the smoke and the pollution from wildfires. Look at those cuties. So we work with children. We've been going to different schools. Summer school was so much fun. And once they find out we have books, it's like, hey, can you come over? And the kids loved it. We asked them to share their favorite page. So can you tell which one? Kids are funny. I remember when we were doing this, and that idea is like, I work with this award-winning author. I'm like, give me some ideas. It's like, come on. And it says, it has to be fun. It has to be fun so that the kids want to read it over and over again. And that's where the cow poop idea came. And it's good because we use the real word, right? The proper way to do it. And in the book, it's kind of funny. And the girls say, oh, and what is that? And she say, cow poop. So it just, kids love that. So the collaboration, here's the artist, Carmen Gloria Momeni. She actually illustrates. She's an amazing illustrator. You can look her up. On oleo is her work. So I am really thankful that she was open to work with us to do this work and do the cartoony-like, but that they look like our heads so that the kids can see themselves, because there is not a lot of representation, as you might know, on children's book. So we visit schools, library, over 20 overall community fairs all throughout, from Salem, Beaverton in the different county, but mostly Monoma, Washington County and Marion County, and work with the community health workers. The community health workers are being amazing ambassadors, taking the book out on their visits and promoting it on their book fairs and the organizations they work with. Here is this cutie, some of the books that we see. Well, I already mentioned some of this, but one good thing in the book is that we have an exercise for resiliency too, where the kids are, she's nervous, and then her dad asks her to breathe through it, and we are able to do that when sharing the book. It's a different kind of storytelling. And part of the project including a website. It's a completely bilingual website. So in the website, the kids can complete a survey to tell us what they think about the book. And so far, most of the numbers, 90% of the kids are age 9 and 10. And they love the book. So that's the certificate. Thank you.
Thank you, Anna. Thank you so much. All right, thank you. Oh, here we go. There's more. All right. So next up, from one of our current awardees, we have Tia Lattanzio from Deschutes County Environmental Health, who will be presenting.
Thank you. Can everybody hear me okay? I'm a little quiet. Okay, thank you. So my name's Tia, and I work for the Deschutes County Environmental Health Department. And both of my other co-project awardees couldn't be here, so it's just me today. So we got our Aspire project earlier this year, of course, and our target audience was childcare, in-home daycare providers. These are just people who have a daycare inside of their own residence, and of course targeting preschool children as well. The goals were to improve knowledge and awareness about indoor air quality, contaminants, and pollutants for the providers themselves, enhance access to resources and materials to reduce indoor air quality pollution inside of these homes, and reduce children's harmful exposure to indoor air quality while they're in their daycare setting. So as part of this, we sent out a survey to gather participants, and we ended up having about 38 of them. So we gave each of them a Purple Air brand indoor air quality monitor. I created a little toolkit for them that shows them how to set up their monitor. Whether or not they actually did that correctly is up for debate. I also offered during the in-home visit an indoor air quality assessment with some fancy tools we have, and offered them a box fan filter kit to create a Corsi Rosenthal box. So let's start with the happy successes. So overall, for the particularly engaged participants, I did see that there was a general improvement in awareness of indoor air quality, what causes poor indoor air. So that was definitely good. We also got to create new connections and deepen the already existing connections that my department has within the community and with these childcare providers. And we got to offer them some really great education about indoor air quality, which is a huge win. And my department, which obviously is the environmental health department, so we get a lot of calls about air quality when it's smoky out in Bend. We got to understand a lot deeper the challenges that these providers have and people who live in the county in general have when it comes to indoor air quality. Part of that deeper understanding is knowing that on average, the AQI was actually lower inside of these homes than it was outside. We hadn't really known that before, and the providers themselves hadn't really known that. I inspect these childcare homes for health, safety, and sanitation at least once a year. So when asking them in the field how is your air inside? They never knew. So it's great that they can now monitor that. So the challenges, I think Sara mentioned earlier, but yes, setting up the monitors and keeping them on were two of the biggest challenges that we had. It seems like every time we set up a new monitor, there was a new challenge. And every time we opened up the map, another one was offline. So just battling those challenges was hard throughout. And then unfortunately for some of the busier or less engaged in-home providers, there was a continued lack of awareness and understanding about using it and how to find out information about their indoor air. You can see a quote there from one woman who was still looking at her weather app, which doesn't show inside air quality, and she finally realized that the monitor that I gave her was showing indoor air, so at least she figured that out, but it did take a while. And here's a little vignette about a interesting challenge. This is a single air quality monitor at a home. And as you can see, the air quality readings were often really high, often above 250. And for a few days there, it was almost like 800, 900. So it was definitely concerning, even when the air quality outside was good in like the 20s or the teens. So we asked her, hey, we noticed it's been high for a while. What's going on? And she claimed that she didn't have anything, no wood burning stoves, no oil diffusers, anything. So we went back out to check it out, and my coworker took this photo, and that is an oil diffuser directly next to the monitor. So she did have an oil diffuser. So my coworker moved that. You can see there the date of that visit was the 10th of September, and immediately after that, the AQI readings went down. So just continued education is something that we're going to keep focusing on as this goes on. All of these monitors also have SD cards in them. So after next smoke season, we're going to gather those and see what we can do with that data. So thank you.
Thank you, Tia. All right, thank you. Next up, we have another one of our current awardees. We have Anna Alyssa Wilson, the co-manager for Equity, Healthy Communities and Environment Program.
Thank you so much.
Yes, it's on.
Thank you so much. Can you hear me? Yes? Okay. Another Anna. A lot of Annas today, and thank you so much for this invitation. It's amazing to be here. Well, I am Anna Elisa Wilson, working for Northwest Center for Alternatives to Pesticides. I know somebody say it's a long name, and Centro Noroeste para las Alternativas a los Pesticidas in Spanish. Everybody say, why Ana Elisa? Because I am Hispanic, I am a Latino. Wilson is from my husband. And I use the Wilson for getting support. But thank you, this is me, and thank you so much. Okie dokie. NCAP's on the grant work, Aspire Center Grant Project Workshop, Outreach, and Listening Session to focus our work on children. This is kind of very important project description and audience. NCAP organized outreach sessions and workshops where we target children between the age of 7 and 12 and their families. Our goal is to have youth population that is including the discussions that affect rural Latinx farm worker families, and the topics pesticide awareness, climate catastrophe, and community health. Target audience, Latinx rural communities in Hood River, Morrow, Melchior, and Umatilla counties, Spanish-speaking farm workers families, many adult lack of legal status in the USA. Project objectives, having a more climate literate youth, increase availability of high quality pesticide safety and climate related resources for children and youth, having a rural Hispanic community that is better equipped to decrease and or eliminate climate related risk. We are providing some of the workshop numbers, and this time we choose one from Umatilla County and the other one from Morrow, Umatilla County. Both workshops belong to the Eastern Oregon as well. The first one was September 18 in Hermiston. Number of attendees, 39 participants, survey response, 70 adults, 3 Mayan mom speakers received support. and Spanish support, that we are providing that Spanish support. 19 minors, 9 responding in Spanish and 10 in English. The second one, it was in September 30th in Borman, Morrow County. Attended 70 participants, survey response, 6 adult, 10 minors, 5 in Spanish and 5 in English as well. Well, some of the questionnaire highlights for adults, we put more reflective this question. And you can see over the 60 of respondents don't talk to their children about pesticide or do not know how to explain them. Very interesting response. And the second one, how do you explain the use of pesticides to your children in a way that they can understand? Most adults struggle when finding ways and resources that facilitate a conversation around this topic. Are the resources you will find helpful to educate your children about pesticide safety? And this is the percent. 50 say that they know of online resources, 20% mention paper resources, while over 30% say they have no knowledge of resources. Are you aware of the presence of pesticides around your children? Over 50% responding saying their kids are exposed to pesticide. The children questionnaire highlights. Do you know what your parents do at work? Over 90% responding affirmatively. And you can see some of another important question related to the kids. You know, sometimes it's hard for them to try to understand what pesticide means. Comments and thoughts. More adults show concerns about having resources and materials to help with educating their children about pesticide safety. Language diversity. While most parents respond in Spanish, 1/2 of the children respond in English. Some of the children that respond in English were Guatemala descent, with Mayan mom as a native tongue. Parents that spoke Mayan mom, 3 receive assistance to be respond. This is a picture of the families and kids, Mexican, from Colombia, El Salvador, Nicaragua, also Cuban people. Thank you. This is going to be the last one. And this is me and Thomas Diaz, the other collaborator from Program Manager. Thank you so much.
Thank you so much. Thank you, Anna. All right, thank you. And while we have 2 more presenters, this is our final current awardee, Lauren Kramer.
Thank you.
Yeah, thank you.
Okay, don't start yet, Marie. I set my own timer too. I'm ready. All right. Hi, everyone. Thank you so much for having me. I want to give a shout out online to Grace, whose name is cut off there at the bottom. She broke her arm last week, which is a great way to get out of public speaking, but I'm here to represent our shared work. So I'm an associate professor of practice with OSU Extension up in the Columbia River Gorge. I've been in that position in the role for about 14 years. Also got my MPH here in 2010, so shout out to the current MPH students, yay. Just to give you a little orientation to my neck of the woods, up in the Columbia River Gorge, we are 100% rural. We have a lot of health disparities and inequities despite being a really rich, abundant agricultural region. We have about a permanent population of around 50,000 folks, but upwards of 60,000 people come into our community each year to handpick all of the fruit that leaves our region. We also have a lot of folks who are underserved, and our region has been designated a smoke-sensitive receptor area. Oops, next. One of the things that has inspired a lot of our work is this is a tile plot from the EPA's air quality page. And so what I want to point out here is this is the monitoring station in the Dalles. And so the line that I've drawn there is the start of the school year. And this circled area is the 2020 Labor Day fires. And so our AQI at the Dalles site reached 599 at its highest point. And that is just to highlight that much of our unhealthy and hazardous air quality days happen after our kiddos are in school, and you can see definitely some moderate and unhealthy days in there as well, as we get some pretty awful winter and fall inversions, a lot of wood-burning stoves and things that hold that poor air quality in very low in our region. And as you all know, and the research literature has made clear, children are among some of our most smoke sensitive and vulnerable groups because their lungs are still in development all the way through age 21. They also have a lot of behaviors that increase their exposure. There's some differences in their physiology that can increase their dose. And they've got a longer lifespan ahead of them that, of course, can make them experiencing those effects even longer and less ability to control their environment. So that's kind of the backstory. And so what we've been doing with our Aspire funding is trying to increase our monitoring. So like a lot of folks, we're working with purple air monitors. We also have temp-top tabletop monitors, and we've been able, with the Aspire funds, to provide those to 19 K-12 public schools across Hood River and Wasco counties. Historically, the schools would basically call the health department, and the health department would say, well, can you see the mountain or the river or across the street? We're not sure what to tell you about outdoor recess or after school programs. And then we've also been working to increase our communications. You can see we've developed a lot of regional resources. I brought some of these if you want a sticker to take with you, but we've developed brochures, stickers, and magnets. We have a really robust website that was launched with the help of our AmeriCorps Grace. And then we've been doing these Join the Fan Club pop-up displays across the community. We had 19 of these spread across health centers, libraries, waiting rooms, any place where the public would gather, especially if it was a health-focused outreach opportunity. We had these up. So we've been doing evaluation data of engagement with these surveys in the community. And then anytime there's a community event or health fair, we are there with our spinny wheel doing wildfire trivia or wildfire smoke trivia and air quality trivia, and also have our Join the Fan Club display set up. Learning from Sara, that's another thing about being a grantee, is you realize you need to label the mouse so it doesn't walk away. So we put labels on all of our monitors, but that's a photo of where all of these monitors ended up across the gorge. And that has the ability to reach over 6,000, almost 7,000 students. That's our approximate student enrollment. But of course, the staff and faculty at the schools are being reached with this information, as well as the students' families and caregivers at home. We've got about 2,000 active users of our website just within the first year of launching. It's not amazing given our whole community population, but we're working hard to drive people to that website. Some of our deliverables, of course, are still in progress, and some have adapted and tried to respond as much as we can to community input. So an example of that is trying as hard as I could to get in to do a staff training, and finally, one more second, finally the kind of gatekeeper for our schools said to me, you know what would actually work best is an instructional video that our teachers could view at any time. And so that is a new deliverable that we've developed, or in the process of developing. We'll have some evaluation for that as well. We are trying to have a really systems-based approach to our work. And I'll just close with that this work can have really far-reaching impacts. This is a photo that I took in August. I was invited by some colleagues on the Warm Springs Reservation to come down and do a Join the Fan Club event. This is impossible for you to see, but the air quality at the Madras station reached 1,135 during the Labor Day fires, and we heard from a lot of these folks that they had kiddos and relatives develop asthma after those 2020 Labor Day fires. So I'm grateful for the funding. We're grateful to be part of this network, and thanks for the opportunity to present today.
Thank you, Lauren. All right, thanks so much, Lauren. And now we have our final presenter. We'll follow this with a break and then opportunities for questions in our roundtable. So we now have Stephanie Foster, who is our own postdoctoral scholar. There you go. Thank you. I think it's on.
Hello. Yeah, great, thank you. I'll set my own timer too here. Okay, I'm ready. Thank you. Hi, everyone. So again, my name is Stephanie Foster. It's nice to see you all today and hear about the amazing work you're doing. So it's really inspiring seeing all the projects that you're doing in the community. I'm just going to share a little bit about a project that I've been working on here at the Aspire Center as a postdoc. So I'll go ahead and move into that. So this room already knows probably a lot about these topics, so I won't spend a lot of time here, but we know that wildfires are on the rise. They're happening more often, more severe, and lasting longer. Which is an issue, especially because children are susceptible to wildfire smoke, like Lauren so nicely explained. So thank you, Lauren. We know that there's a lot of things that can happen with kids exposed to wildfire smoke, like respiratory morbidities, like asthma, wheeze, difficulty breathing, and even some altered lung growth trajectories. So this is something that we're concerned about. And in order to really protect children, we have to understand the exposures that they're having, where they live and play and go to school. And so specifically thinking about the school setting, we know that there's almost 50 million students that attend public school in the US. And of young kids who are receiving non-parental care, most are in a daycare center or some sort of a preschool program. So we wanted to take a look at some trends in wildfire smoke exposures at public schools and childcare centers over time. So specifically, we zeroed in on 2006 up to 2020. And we did some secondary data analysis for this project. So this was publicly available data sets. So the first one there, we got some daily wildfire smoke estimates at the census tract level from the Echo Lab at Stanford University. We also were able to get a hold of some public school point location information and characteristics from the NCES and childcare specific information from the FILD. I'm sorry, I'm not going to say those whole acronyms. You can read them yourself. And then we also were able to get some information on school start dates from the Pew Research Center, so we can kind of estimate the academic school year time. And some of the specific outputs we were kind of looking at for this study, we wanted to get at the average number of smoke days every year for schools and childcare centers within given census tracts. And we also wanted to classify those smoke days based on the PM 2.5 concentration on those smoke days. And then lastly, we wanted to look at the sum of student smoke days, so based on the total number of students enrolled at each school for a given year. So, and if you want to get a little more into the nitty gritty, you can ask me about how we define smoke days and stuff during the question session. So these are just some initial findings. You can see along the x-axis there, that's just the academic years. And on the y-axis is the average number of smoke days for that given year. And it's broken down by the PM 2.5 category. So the purple is just any smoke day at all, which you can see there's just a general trend of upward. So more smoke days happening over time. This is specifically during the academic school year. So this does not include smoke days happening during summer breaks. And then you can see that kind of a similar upward trend for the less than 5 micrograms per meter category, a little bit less obvious trend for those higher PM 2.5 categories, which is a good thing, I suppose. And then I also wanted to show you, I apologize, the categories are a little different. I need to update these for the childcare center ones. But this actually is encompassing the whole year. So it's not just during the school year, because childcare centers are usually running continuously. So you can see there's the average number of smoke days every year is on the rise as well across most of these categories. And then this is looking at the sum of student smoke days. So the units here on the y-axis, you're looking at every time a student was exposed to a smoke day, potentially exposed to a wildfire smoke. And so you can see that it's showing like it's on the rise as well. And again, this is not including the summertime smoke days that are occurring. So I know it's a really big number up there, but in 2017, 2018, students experienced smoke days over 1.1 billion times, which is a little wild. So our next steps, we want to look at indoor air quality relative to outdoor air quality in schools and childcare centers. And like so many of you, we're also going to use purple air to kind of look into that. We also want to explore some differences by state, by region, by some other characteristics, and also kind of start incorporating some other environmental health indicators into our study. So we're excited about that. And I just want to give some acknowledgments really quickly. Thank you so much to the Aspire Center team who's been so supportive through all this, especially to Dr. Perry Heistad, because he was the brains behind this whole thing and really started me on this project. So thank you, Perry, for all the support. And to Dr. Andy Larkin, because he really helped me with all the crazy coding that goes along with handling massive data sets. So thank you for that. And thank you so much for your time.
Thank you, Stephanie. Wonderful. Thank you. Perfect. All right. Well, those are all of our presenters for today, and we had a scheduled break. But I think what we're going to do, we're still going to take the break, but we'll just we're going to take about 10 minutes. So let's reconvene at 4:25 back in here, and we'll have our roundtable. So save all of those questions for 4:25, and we'll see you shortly. Thank you. All right, I think that we have all of our presenters now at the front. So thank you all so much for your presentations today. And we're going to now, it's a roundtable, so there's opportunities to ask each other questions, but also for the audience to ask questions as well. And I'm going to go ahead and get it started. Also, the mics there should be two. Here we go. Yeah, and they should also be on. Yeah, this is like our one way to get everyone together. So I'm going to open it up with a starter question that's really for everyone. But what are the biggest barriers to making meaningful changes in environmental exposures for the people you serve? What are the biggest barriers for change with the people that you serve? So does anyone want to get us started? And we can ultimately just pass these mics along.
I'm happy to.
Okay.
So when I think about the people that we've been working with, some of the work we do when we go to the schools, for example, and do the story time, we also do games with the students. And one of the things is that people are not talking enough about climate change because, some of the research shows surprisingly to us Latinos, and I say that because everybody we share this with, they're like, really? Like, Latinos are very forward for action. They want action, and but because they're one of the most impacted, right? One of the most vulnerable community, but people are not talking about that sometimes because they're afraid or because they just simply don't know and they don't want to look like they don't know anything about it. The basic words like greenhouse gases and resiliency, people don't even know what they are. So not because of the language barrier, because they just don't know even in Spanish. So that's one little thing. I'm sure there's a whole lot, but that's one thing that I'm seeing, like a lack of having those conversations and even knowing how to talk about those things without the anxiety and all that comes from it.
Thank you.
Is it on? I think for the communities we serve, there's two things. One is systemic racism. I think systemic racism is a big barrier, not only for when we talk about climate resiliency and mitigation. We see that low majority communities, vulnerable communities don't have the access or the resources to be able to even have the information they need around what to do if there's wildfire smoke, or like access to a toolkit, access to any of those. We see usually vulnerable communities live in places that are very affected by all these climate, issues, wildfire smoke. They don't have the possibility to quickly go to somewhere else. They don't have a place where to go. So that's one. And the other big one that I was shocked was when I realized that pregnant people were not included as vulnerable communities to wildfire smoke. And when I openly asked why, they were like, well, they're not children. We don't see, they're not old. They're not, there's no disabilities. Pregnancy is not a disability. I'm like, yeah, but they were growing a child. And there's like a lot of studies that have been done into the effects of wildfire smoke and extreme heat while pregnant. So yeah, I would say those are the two big barriers.
Thank you. Anyone else for this question?
I can add one. So I think pragmatic barriers in working with our school partners, they're just extremely busy. I was telling Stephanie that our schools have had some of their monitors since May, and they just got plugged in yesterday. I was seeing them come online. And so just trying to be not too nagging, but encouraging, like, please, can I help you? Or what would it take for us to get those monitors online? We missed a whole summer of data collection just because they were really busy and they have a lot of other priorities. I think knowing that ultimately we want to help the schools to make some infrastructure improvements is going to be another enormous barrier. They don't have millions or maybe even billions of dollars to retrofit all of their buildings. And I think some of our principals and administrators are notably, and I think for good reason, a little hesitant to have the data, because then they're responsible for making some changes once they know that their building envelopes aren't adequately protecting children during the school day. And so there's some concern there, and I don't know how to always walk that fine line of supporting them to have more information, but also realizing that, yeah, what are we going to do if it's 300 inside and 300 outside on a given smoky day?
Thank you. Any other questions from the audience? Oh yeah, we put a chair up there, sorry.
Thank you. Hello. So I have a question, and it's just like, especially for those who are currently using or planning to use like the air quality monitors, especially when it comes to like public places like homes and stuff. I guess like just how do you like imagine or plan like to like help set those up and just prevent people from misusing them, I guess you could say, or just, you know, protecting these monitors from being like, say, too near like ovens and other things that produce smoke.
Sara and Parichehr have some tips because we've talked about them too, but we've provided an installation guide based on the Purple Air recommendations about where to site the monitors both inside and outside, kind of where to avoid and intakes and different air exchange systems and all of that. And if you are seeing spikes, to note that maybe there is something happening inside. Mostly all of ours are in schools, so we're hoping that their IT or whoever the team is reading those instructions thoroughly and following them.
Experience of trying to address this challenge. So there were number of like checklists and recommendations that we were trying to follow during our pilot project that we gathered from the APA resources and so on. And then some of the challenges that Sara and others shared today that we experienced ourselves firsthand that like we were not even thinking about as we first started this field research. So we added those as well. And then as we were trying to establish and launch this new EPA project, part of the requirement was to develop a quality assurance project plan. And as part of that was like just like months of thinking about in a more systematic way, how do we deploy the sensors in a correct way? What are the requirements for the deployment? If we have to do a pre-deployment calibration test so that we don't just, for example, send the monitor to the school and ask them and put the burden on them to say, okay, like this is right off the shelf, deploy it and use it. So following some of the best practices that have been sitting in the scientific papers, but it's just so hard, and owners ask the school principal to have to go through that process. So try to take that on, and so pre-deployment, calibration, deployment, QA/QC processes, and then having regular visits to the school sites, for example, to check for those instances that, for example, one of the presenters today shared how, for example, they had a oil diffuser. We had some kind of similar experiences, but doing those regular visits, as for example, Sara has with the schools, just checking on the sensors if they have been moved around, if there's like a source or sourcing of air pollution near them, and then also a post-deployment calibration. And we're hoping that as part of this toolkit that we're developing, we can translate all of this information in something that is more digestible for a layperson to be able to understand how to use their sensor, how to understand the data, and how to take action based off of that.
I can give one example. We had our ScienceWorks monitor. It's a children's museum. The PA2 was mounted right near the outlet for the HVAC system, so it actually was mounted where it would likely have the cleanest air. And so when students came, we moved it from where it was about 25 feet above this big hall area in the museum, closer to the entrance at more of a breathing rate level, and in a space where it would make more sense for having the quality of data that we'd like to be collecting as part of the project. And we haven't done a lot of monitoring in homes yet, so I don't have a lot to cover for that.
Yeah, in homes it is harder because there isn't a lot that we can control about a person's residence, of course. So the oil diffuser example is a great one. And we actually, the project team decided the first one that we delivered, monitor that we delivered, we just let them put it up, like set it up themselves. And they couldn't do it. They didn't have time. It took like weeks for them to even get back to us that they needed help. So we just decided after that to go and set it up ourselves. So that gave us a little bit more control about where to place it. Obviously, stuff gets moved around. They get unplugged and moved often. As part of our toolkit, we also did like a siting instructions page, and clearly that was not read, or they didn't, that information did not stick with them. So it is a challenge, and especially in a home, stuff gets redecorated, or they just put up an oil diffuser and didn't think about it. So it's definitely a huge challenge, but you just have to know your audience, I think, and sort of stay on them and nag them a little bit.
Wait till you read by me. Well, thank you everyone for coming. It's so awesome to see all the work you guys are doing. And I really want to know what you want to do next. So sort of like pie in the sky, don't worry about resources. What would you do next to follow up on these pilots? Because I think that's really where we're at now, is how do we extend these, right? These are all amazing. How do we extend them to reach more people, to have more impact? So I'd love to hear like what each of you guys are thinking about for next steps.
For us, really, it has come about educating the people that is on the ground, that is working directly with the families, with pregnant people. So we created this advocates program that really gives you all the tools and all the information to really spread the word in the community. We have found that working with professionals on the ground and the professionals that have this relationship with different families, with pregnant people, it's an easier way to spread the message. So we really are training them on all these resources and all these toolkits so they can kind of spread the awareness throughout whatever area they're serving. And with different community organizations, with different healthcare providers, we really are trying to make a point on the importance of getting educated and how to, bring awareness around mitigation and resiliency when it comes to infant and pregnant people's health.
Well, also I am a doula as well.
Oh, yay.
Yes, and I am an instructor of health, chronic disease for the Latino Hispanic speaker from the Stanford Program University. Well, the part of our work that we are doing on the ground is use, the most easy way to provide education. For us, education is the key under the structure of popular education, because we are receiving a lot of people immigrants, Latino farm workers from the Latino countries, Salvador, Nicaragua, Guatemala, and they even speak Spanish language and Mesoamerican languages and indigenous languages as well. And that we can see is providing education the best way they can understand how it's so dangerous when they have to work almost all day and they doesn't need to get a protection equipment and they doesn't like it. We were so close with them because one of the barriers is not only the language, it's cultural, it's education. We need to be immersion into their culture. And this is part of our work that we are doing through the local business, churches, different, type of churches. And we have a very good relationship with the CBOs and, in different parts of the Eastern Oregon. But, this is not enough because we are seeing a lot, numbers of people arriving, from another state, from Washington, from Idaho. Even this program is amazing, and thank you so much for support our work. We have another way that we are communicating in their language and their way that they can understand is the radio show that we have every Tuesday. I am conducting this program. I'm doing, a lot of resources and easy to way that they can understand and be part of this movement. And I say part of our work is making some knowledge and consciousness because they need to change. I say it's not easy to cross the border. You have to learn the culture from here and adapt the rules and try to learn, because one of the another topics that we are having very issues in those community is the kids. They are losing their mother's tongue, and there are going to be teenagers, high school kids in the various of the language, especially for the Guatemalan community. They speak more than 4 Mesoamerican languages: Canjobal, Popti, Quiche, Mayan Mam. Is too hard to understand. Even, some of them, they doesn't understand very well the Spanish. I'm doing a lot of resources and events on the ground and try to provide education in their style, not my style, not from my work organization style. No, I have to work in their style. It's so interesting what's happening, because we are living in the United States. But this is that another problem that we are having. I'm talking with them about the chronic disease, diabetes, asthma, cancer, getting a pesticide problems, air quality, the people are suffering too much. But the various language is a huge problem. But we are going to continue to work with them, and thank you so much for the support. Thank you.
Anyone else for that question?
I'd really like to see us be able to leverage this research and work into investments that can be made into community projects and the infrastructure that we need to have our schools and childcare centers be more ready for climate change. And I just was in my son's neighborhood today, and it was a Head Start that was in an old school that's been decommissioned from K through 12th grade education system into Head Start, which is all part of the, the educational system. But I'd really like us to have high quality schools and programs that are providing for social equity, for health, and the infrastructure that's needed to keep our kids safe from heat and smoke.
Thank you. Oh, go ahead.
No, you go for it.
One thing that we have been seeing is, as I mentioned before, sometimes people don't even understand the basics of how to be protected or how to advocate. They shouldn't have to, but the systems, they're not built for our communities, for immigrant communities, right? So they're the one being impacted, even though they don't have a lot of control. So education and using popular education is key with these communities. So we have people from the mobile homes where we went to read to the children. The adults, the parents were very interested in it. It was a story time for the kids. And they're like, oh, can you guys bring training for us? Because we need to know this stuff. We need to know how to be ready for emergencies and all that kind of stuff. And we're getting people on the website sending us video from all over, not just Oregon, from all over the world. We're getting videos of kids, what they're doing to save. Like, I'm unplugging my cell phone. Like, people want to do things, but they need to know what they can do. And one of the major things that we're seeing repeatedly is the advocacy part. So it's like, how do we do that? How do we talk to elected officials? So I think that's where we want to invest time, doing training about how to go and talk in Salem, organizing groups from those mobile homes where we go, doing the training, and part of the training using popular education, where they can actually learn how to go and lobby or whatever it is that they can do in Salem, like step by step, preparing, practicing, and all that kind of stuff. So I would love to be able to do that. If we are able, we say we can dream without worrying about the money.
Yeah, I guess for me specifically, and sort of like going off what Sara said, it's a lot of like infrastructural challenges for, schools or childcare centers or homes that don't have HVAC or like poor quality HVAC and no insulation. So if I could do anything, I would advocate and like policy and like legislature to change some of the rules surrounding childcare homes and centers. These places are regulated and licensed, and I know because I inspect them and I do plan reviews for the centers, and they are not required to have HVAC, which I think is a huge downfall. So that's why a lot of these homes are allowed to continue operating and serving young children, babies, infants, even though they don't have HVAC and the air quality might be just as bad inside. So, I mean, it would be great if we could rally and maybe get the state, the Department of Early Learning and Care to change some of those rules on that. It might be a big lift, but I would love for that to happen eventually.
Thank you. Other questions from the audience or from the panelists, other panelists?
So my name is Molly Kyle, and I just want to say that it was so wonderful to hear everything that you're doing, and I'm really inspired. So I want to actually add on to what Perry said. Some of you have already kind of thought about this maybe, but what would you want the university and the Aspire Center to do or provide to help you achieve those goals? So how can we help you from the perch that we have here, that I really appreciate all of you traveling to? So thank you.
To Molly's question, I agree with it, but this was time limited, anything, time, buy-in, collaborations, what, kind of just putting things out there.
Somebody who knows this, could use student interns. I could, what help us help you.
No, go for it.
I think this can happen a little bit organically, but connecting each of us in the cohort to one another. I took my own notes. I want to translate and apply Dan's findings to our parent outreach, and I want to apply the engineering work back to our schools. That's something I think Extension does really well, but I think also from your perch, as you said, you're seeing the whole picture of what each of us is doing, but we may not be, unless we come to these, as familiar with everyone else's work. So just connecting that to all of us. Like if anyone's doing parent outreach, Dan's team has done great work on the messages that resonate best. And if you're trying to work with schools on infrastructure upgrades, here's some research we have out of the College of Engineering and the College of Health. Like, how do we bring the research from campus at large back into our communities? I think would be really great. I don't always know who the researchers or people are that I should be asking those questions, but that's something I think could be really helpful.
Well, I'm going to say thank you so much, but if you can give us any kind of support, extra hands, extra money grant support to implement more workshop and education and hiring volunteers, bilingual volunteers in our case, this is going to be great and awesome help for us, because education takes a lot of time, especially to break barriers. As a Latino, I have a lot of experience working and educating people that they born in the United States. Even they have a Latino parents, they doesn't know very well the culture. And this is one of another biggest problem, educating the junior generation from here, from the United States, to try to get more engagement with the immigrants people and try to help them. But if they has not a lot of information in the way that they can be more productive for them, this is not going to happen. And I can't be in different states and places in the same time, right? But for us, this is going to be great if we can continue to support those programs and educating the people and working so close with farm workers' families, especially the topic, the prevention to be exposed to pesticides and chemicals and all that kind of stuff. Thank you.
I think the collaboration between researchers and community organizations needs to happen more often. I'm part of a community advisory board with U of O at an NIH project that they've been working around vaccination testing of Latinx community members. And I think researchers have all the data and the information, and a lot of the times, how do we make this information accessible for community members? Because I'm not a researcher, and I look at research papers and I can't. It's really hard for me to understand, but how do we work together around the same goal? How do we make all that data that you work so hard on obtaining, but how do we make that accessible for community members? Do we make videos? Do we make infographics? How do we do all this together so we can really spread the message? Because I think we cannot no longer work in silos. We have to work together.
One thing is, I'm an instructor at Pacific University of Latino Family and Culture, and it's for the students in their Master of Social Work. And because we're talking about Latino family and culture, I just couldn't leave climate out of there because the Latino community is so impacted. And they were so thankful that I put that in the curriculum. Like the health impact on the Latino community, that it comes from all this climate change and global warming. And that kind of brought to my attention because on the feedback that I received from the students is like that there is not enough conversation about that. And these are professionals that are going into social work in May. I mean, they're done pretty much. And they're going to be working with our communities. And I appreciate so much that they are dedicating the time at Pacific to have a course that is specific about the culture. But I can see there being, for those kind of professionals that are working with the Latino community, and you being a university, like maybe looking at those syllabus and see in what class, there can be some kind of something that can be added, because the reality is that climate change can be added. I mean, if I was able to put it in that class, I'm sure anybody can put it anywhere, because there is, So I'm just saying that there is potential to do a little bit tweaking, to start more, the same way that we're saying it needs to be happening at the elementary school level, but it also at the professional level as well.
Thank you. Anyone else got a question? We probably have time for one more. Any burning questions from anyone in the audience? That's what I meant. Yeah. Anyone, or from any of the panelists as well, to each other?
Sorry. I'm going to take this moment to ask you your help. If somebody's going to provide information, needs to be in both languages. I prefer that, because we are talking about educate the youngest kids, the new generation, but seriously, the problem barrier is the language and the information. How is going to be the best way that the parents, they can be on the same page with their kids, because their kids, they are so great and awesome sponge, very brilliant brains, bilingual kids. But the problem is the parents, they don't receive, enough education in their own languages. If you are going to see or create some videos or resources, please do it and thinking in the Spanish language under the popular structured education. It's possible. Suggestion. Thank you.
Well, I just want to take this time to thank everyone for all of your presentations today on behalf of everyone at the Aspire Center. And we are all going to be here. There's some food outside. We would love to just chat, be a little bit more informal, and feel free to ask any of us questions. But we also really hope that you have an opportunity to connect with each other too. So please join me in giving a round of applause to our panelists. All right, thanks everyone. And there should be food, I think, set up outside.
I'm gonna hopefully take a picture with everybody.